more and more young people are dying of heart attacks. Is this true? And if so, why? Everyone, I am Dr. Kishan De Silva, consultant cardiologist. Of late, we have been hearing of young people dying of heart attacks, heart-related conditions, 30, 50, 40 years old. Now, is this a media hype or is this actually a fact? Unfortunately, it is. It's a fact. Globally, we are seeing a higher incidence of heart disease, heart attacks, probably fatal in this age group. So the 30s and the 40s are now considered the new 50s. So globally, when they looked at what the probable causes are, sedentary lifestyle has been, because of all these electronics and social media, people spend more time with their phones rather than being outside, being active, leading to obesity, directly causing probably as a risk factor, or via diabetes, developing diabetes, which we know is increases the heart disease, risk of heart disease by twofold, doubling the risk. Also implicated are the narcotics and drugs, probably having a direct toxic effect. The thing with young heart attacks is that they are very dramatic. When we say heart attacks, the reason is that the cholesterol gets into the arteries, the linings of the arteries, and builds what we call a plaque. Now these plaques can be what we call stable plaques, which slowly progress to becoming blocks and a narrowing of the blood vessel, and they develop angina, that is chest pain, jaw pain, whatever, when they do something. That is called stable plaques. Also we have unstable plaques. These are plaques that maybe for inflammation or other reasons can suddenly rupture from within. When that happens, the raw surfaces of the blood vessel get exposed and the blood makes a clot there. So from a normal blood vessel there was a plaque without a narrowing, without any symptoms, suddenly you have a total block and a massive heart attack. So these are the people that we have heard of who played a cricket match or a soccer match the day before and got a heart attack the following day. Why these are more dramatic is the blocks that grew over a period of time. The body had time to build extra blood vessels called collateral circulation. These 30s, 50s, they haven't had time to build their collateral circulation, so they are dependent on these main arteries. So they are more dramatic. After 50, 60, we see them more as angina and we can manage them. Also, when we talk of these sudden deaths, the majority are obviously blocks related, but there is another condition called sudden cardiac death due to potentially fatal rhythm disturbances. So the reason why we are highlighting this topic today is that if not all, most of these conditions can be detected early. There are ways to do so, even a simple ECG or an echocardiogram, just listening to the story, background. We have some risk factors. The main risk factors being getting old, we can't do much about it. Genetics, we can't do much about it, but we have 5 potentially modifiable risk factors: smoking, high cholesterol, diabetes, pressure, poor lifestyle. All these things can be controlled. So when we see these patients even at a young age, we go aggressively at controlling these risk factors. The take-home message in my case would be, at least let's do one checkup to see whether there is anything we need to modify to reduce the overall risk of having a sudden cardiac death or even developing heart disease later age.